Let us begin with our lecture on posterior triangle. In this lecture, I'll be covering all the important points from exam point of view. Let us begin the lecture with covering the boundaries. The first important point, that is boundaries. Any triangle, it is formed by three sides. First is the anterior side, then the posterior side, plus a base or inferior side, and a meeting point, that is apex. Now this triangle, it is formed by anterior boundary. Now anterior boundary here, it is formed by posterior border of sternocleidomastoid. As in the diagram, you can see this is sternocleidomastoid muscle. Its posterior border, it is forming anterior boundary of the triangle. Then we have trapezius muscle that is forming the posterior boundary, the anterior border of trapezius forming the posterior boundary. This is the anterior border of trapezius. Also, the base of the triangle, that is formed by clavicle, that is present over here. Clavicle, not the entire clavicle is forming, only the middle 1/3 of clavicle is contributing to inferior boundary. Then we have apex of the triangle, that is formed by fusion or the meeting of sternocleidomastoid to trapezius muscle, that is formed at superior knuckle line here. Let us then talk about the roof. Roof, it is formed by investing layer of deep cervical fascia. Whenever we talk about any part in the body, we first talk about we have to dissect a part in the body. We'll first remove the skin. There will be superficial fascia, there will be deep fascia. Similarly, in this triangle, the roof, it is formed by what? By investing layer of deep cervical fascia. Also, there will be a superficial layer of superficial fascia, and that will be containing various anatomical features or contents. The first content of this superficial fascia is platysma. Then you have external jugular and posterior external jugular. Now, external jugular vein, as you can see in this diagram, here there is presence of external jugular vein. I'll also be showing posterior external jugular vein later in the video. Then you have next structure, that is supraclavicular, greater auricular, transverse cutaneous, lesser occipital nerve. All of these nerves you can see in the diagram. You can appreciate all these nerves in the diagram. There is supraclavicular nerve, there is great auricular nerve, there is lesser occipital nerve. All of the important nerves are present over here. Then there is transverse cervical and suprascapular arteries. There is here, as you can see, transverse cervical artery as well as suprascapular artery. Both the important arteries, as you can see in this diagram, there is transverse cervical artery and suprascapular artery. Both of them are a part or content of superficial fascia. And finally, lymph node. As you can see, these lymph nodes which are present over here, all of them, they also form important part of superficial fascia. Let us then talk about external jugular vein. As you know, it is one of the content of your superficial fascia that is present over the posterior triangle. External jugular vein, it lies deep to the platysma. It is formed by union of two veins, that is posterior auricular vein and posterior division of retromandibular vein. Let us see these veins in the diagram. Okay. So here you can see the retromandibular vein. Now it is going down, forming the posterior division of retromandibular vein. Simultaneously, you can see another vein coming down, that is the posterior auricular vein. It is coming behind the ear, therefore it is called posterior auricular vein, that meets at a point to form another vein that is called as external jugular vein. Okay, so that clearly explains the point. External jugular vein, it is formed by union of posterior auricular and posterior division of retromandibular vein. It begins with the lower part of parotid. Here, somewhere your parotid gland is present. External jugular vein starts at the base of or the lower part of parotid gland. Now, tributaries of external jugular vein, I'll mark them in this diagram. Okay. So, there are tributaries. Firstly, let us see. This is the external. I'll change the color. Wait. Okay. Yes. So this is the external jugular vein. You can see tributaries. The first tributary is posterior external jugular vein. As I said, I will be showing you posterior external jugular vein. It is present here. Another tributary is transverse cervical vein. That is this. Then there is suprascapular vein. This. Anterior jugular vein. This. So these are all the tributaries of external jugular vein. The next topic here is floor. It's formed by prevertebral vertebra से पहले वाला layer, prevertebral layer of deep cervical fascia. Now this layer of the prevertebral layer of deep cervical fascia is covering the important muscles. I've marked these muscles over here. The first muscle, that is semispinalis capitis. It is here. Then you have splenius capitis, another muscle. Then there is levator scapulae muscle. And finally, there is scalenus medius muscle. All of these muscles are forming the floor of the triangle. So, whenever they are asking you what forms the floor of posterior triangle, you say prevertebral layer of deep cervical fascia, which is covering four important muscles. You need to mention all these muscles name. That is splenius capitis, levator scapulae, scalenus medius, and semispinalis capitis. Then very important contents. The contents are majorly nerves, arteries, and lymph node. The first thing that we have is in nerves is spinal accessory nerve. You can see spinal accessory nerve over here. I'll mark that with yellow. Then four cutaneous branch of cervical plexus. We have made a mnemonic for that, that is GLAST. Okay. So first is the four cutaneous branches. Of course, there are five. We consider A or the accessory nerve as extra. But it is also a cutaneous branch. So what are the four important part of cervical plexus? First is greater auricular nerve. Then you have lesser occipital nerve, supraclavicular nerve, and T, transverse cervical nerve. You can appreciate all of them in this diagram. This is the transverse. This is your supraclavicular nerve. This is the greater auricular nerve. This is lesser occipital, and also there is presence of this nerve, which is spinal accessory nerve, which we have already mentioned. Then there are muscular branches. We have roots and trunk of brachial plexus. Brachial plexus trunk. I'll show you the diagram. Okay, so brachial plexus, as you can see in this diagram, you can appreciate all of them in this diagram. There is presence of upper trunk, middle trunk, and lower trunk of brachial plexus. Then you have nerve to serratus anterior, nerve to subclavius, and suprascapular nerve. That is it. So we'll then go to the nerve vessels that are present. Vessels as in arteries. We'll be seeing all of these contents again in the diagram. Let us first focus on the theory, the vessels. That you need to, okay, so writing all these in exam is very important. First, mentioning all the nerves. In the similar pattern, you can mention the vessels that are present. First is transverse cervical artery and vein, occipital artery, third part of subclavian artery and vessel. Then we say commencement of transverse cervical artery and terminal part of transverse cervical vein. I'll be showing all of this in the diagram. And lower part of external jugular vein. There is also lymph nodes, as I said, two important ones, supraclavicular and occipital lymph node. Now let us appreciate all of them in a diagram. This is the diagram. I've marked all the important nerves with yellow and arteries and veins with red. Let us first talk about the nerve. The first nerve that we have is spinal accessory nerve that you can see. This is the spinal accessory nerve. Then trunk of brachial plexus, which we have already seen. All these are trunk of brachial plexus. Then there is nerve to subclavius that we've already mentioned, nerve to subclavius. Then there is the four cutaneous branches, lesser occipital, greater auricular, transverse cervical, supra clavicular nerve. We have a mnemonic for that, GLASS, in which we also include spinal accessory nerve. Then let us talk about the arteries and veins or the vessels that we have. First is transverse cervical artery. Then we have subclavian artery, especially the third part of subclavian artery. Also subclavian vein is present. Then you have external jugular vein and occipital artery. To remember all the vessels, I've made a mnemonic for vessels, that is TOES. TOES is transverse cervical, O for occipital artery, E for external jugular vein, and S for subclavian artery and vein. So that is how you can remember the vessels. For lymph nodes, we have two important lymph nodes. The first one is occipital lymph node and supraclavicular lymph node. With this, we are done with the contents. And for this is all you need for your answer that you need to write in the exam. You can score extra marks if they ask you clinical cases and you name them. Yes. So first clinical case that we have is enlargement of supraclavicular lymph node. The main causes are TB and Hodgkin's disease. The second clinical case that we have is second part of subclavian artery compressed by first rib. Subclavian artery. The third part of subclavian artery was a content of your posterior triangle. Now, the part that lies before it, that is second part of subclavian artery, gets compressed because of the first rib sometimes, as you can see in this diagram. Narrowing of subclavian artery because of the first rib. So this is it for your posterior triangle. Stay tuned. If you want these notes, please comment.